Hello, I'm Kim McFarland, and I am a licensed professional counselor and a national certified counselor from the state of Michigan. One of the most common questions I get as a counselor is about borderline personality disorder, or BPD, and how it develops. And today I want to provide a detailed explanation of what BPD is, how it typically develops, and what it means to have BPD. First, let's take a look at what a personality disorder is and how it's defined, and then we'll define what it means to have borderline personality disorder. The Diagnostic and Statistical Manual of Mental Disorders defines a personality disorder as characterized by an enduring pattern of inner experiences that deviate from your cultural norms, pervasive, inflexible, and with symptoms typically starting in adolescence or early childhood. So by pervasive, we mean these inner experiences are spread throughout every part of your life. And when it deviates from your cultural norms, these are the shared beliefs that you have that guide your behavior in a particular culture. And since these personality traits are very maladaptive and inflexible, they cause extreme distress, right? And distress is having those extreme emotions and painful emotions or impairments. The DSM-5 specifically says BPD is a pattern of instability in interpersonal relationships, self-image, affects, and marked impulsivity. So getting a proper diagnosis is important if you think you have BPD. Getting a therapist that treats BPD is extremely important, and getting a therapist with experience and training in treating BPD is very important, and getting a supportive treatment team for your BPD is also very important. And while there are medications available that can help treat some symptoms such as your depression or your anxiety, there's really not any medications that's going to treat your personality symptoms. So let me say that again. There is currently not any medications that can treat your personality traits. However, medications may be beneficial to help with stabilization and to manage your symptoms or maybe mood swings. And by managing these things, we can create a space to help you learn how to apply behavioral changes and learn to manage your symptoms that cause you discomfort. It's essential to have a supportive environment to help you learn behavioral changes and manage your symptoms that cause you discomfort. Remember, you're not alone, and seeking help is the first step toward understanding and managing BPD. And remember, you are not your BPD. That is something that you have. It's like if you have heart disease, you don't go around telling everybody, "Oh, I'm heart disease." You often hear people be like, "Well, I have BPD," or "I am BPD," or this is how they identify themselves. You're much more than just the BPD. So let's take a look at the criteria that you have to meet according to the DSM-5 in order to have a diagnosis of borderline personality disorder. So you have to meet 5 of the 9 criteria. The very first criteria is frantic efforts to avoid real or imagined abandonment. So this means even normal separation feels very overwhelming. Also, a change in plans or cancellations can cause intense, ineffective reactions to situations that can result in harming relationships. Individuals with BPD can feel abandoned over the smallest sense of separation or rejection, even if the sense of abandonment is not real and the other person is not trying to leave you or reject the individual with BPD. Number 2 criteria is a pattern of unstable and intense interpersonal relationships, characterized by alternating between extremes of idealization and devaluation. That means one minute you think someone is the greatest person and perfect in every way, and the next minute you may feel like this person doesn't love you enough, doesn't care about you enough, or is being mean and rejecting you. Number 3, identity disturbance. So markedly and persistently unstable sense of self or self-image, right? This can be rapid changes in the way you see yourself. You might change who you are based on your values, based on what you think matter to other people, based on what you think other people may want to see from you. You may also see yourself as bad, unworthy, unlovable, or as if you don't matter or exist. Number 4 criteria is impulsivity in at least 2 areas that are potentially self-damaging. This is things like spending, risky sexual behaviors, substance use, reckless driving, binge eating. This is being impulsive and risky in behaviors that may even include ending relationships on a whim, or suddenly quitting your job, or sabotaging good things, things that could be successful for you, and sabotaging those in some way, very impulsively. Recurrent suicidal gestures, threats, or self-mutilation behaviors, that's number 5. So with BPD, individuals often engage in self-injurious behaviors, such as cutting or burning. They make threats or suicide, or actually attempt suicide. Self-harming behaviors usually occur during dissociative experiences, and often allows somebody with BPD to feel something during that time, because a lot of times people will feel very numb, emotionally numb, and they're looking to feel something. So both suicidal gestures and self-harming behaviors are often in response to abandonment, rejection, feelings of being overwhelmed, even by the expectations of life, just being overwhelmed by that. Number 6, affective instability due to marked reactivity of mood, such as intense irritability or anxiety lasting for a few hours and only rarely more than a few days. This means you're going to have intense mood swings, ranging from periods of maybe being very happy to very irritable or anxious, or feelings of shame and not being worthwhile. And your mood swings are going to be quite rapid. Maybe 1 minute you're fine, the next minute you're not, and then 5 minutes later you're back to doing something different. Number 7, chronic feelings of emptiness. So chronic means the emptiness is ongoing. And although it may not be constant day to day, it's going to be there, right? It's going to be there with you the long term. And these feelings can be very intense and recur again and again. Feelings of emptiness can be very painful and intense. You may feel disconnected from others. You might feel like you're not real, or that you don't matter. You might feel easily bored, or a constant need to be doing something. Criteria number 8, inappropriate, intense anger or difficulty controlling anger, such as frequent displays of temper, constant anger, or recurrent physical fights. So you might become very bitter, sarcastic, lose your temper a lot, push loved ones away, have verbal outbursts. And these behaviors are often as a result as seeing the people around us as uncaring, neglectful, or abandoning us. And number 9 is transient stress-related paranoid ideation or severe dissociative symptoms. So during times of extreme stress, you may have what's called depersonalization occur. So you might feel disconnected from your body. You might feel disconnected from your world. You might feel that you're not real. You might even see yourself as being outside of your body. Feelings of numbness are also very common among those with BPD, as well as sometimes you can have hallucinations, body image distortions, or even feel like you might be in a dream state. So let's talk a little bit about BPD and emotional dysregulation. So individuals with BPD are very sensitive to their environment. They have difficulty with their plans changing, difficulty with tolerating painful emotions. Now, when we talk about being upset with someone or something, that's not the same as dysregulation, right? So for individuals that have BPD, dysregulation means they are feeling out of control with themselves, out of control with their emotions. Their responses are highly reactive, intense, and extreme. And this means someone with BPD is reacting without thinking or giving very little thought about consequences. They're reacting based on those intense emotions, and they may even blame the other person for their behavior, for them getting upset. They may become resentful, angry, and be reactive with explosive and intense anger or even insecurities. So individuals with BPD don't have a mild being upset when they're dysregulated, right? It is painful and it is intense for these individuals. So individuals with BPD may also become extremely impulsive when dysregulated, engaging in risky or dangerous behaviors. And after a person with BPD has calmed down, they may feel shame, guilt, remorse, feel worthless because they feel so out of control. They may be more depressed, anxious, have some panic, feel sorry, rage, emptiness, or loneliness. And then all or any of these factors can impact friendships, relationships, family, further leaving the individual to feel abandoned because maybe their dysregulation has pushed people away, or people are blaming them for not being able to get themselves together like they're supposed to. So how does one develop borderline personality disorder? Well, there's not a clear-cut answer for how one comes to develop BPD. There's some genetic and physiological factors, as well as some environmental factors that contribute to the development of BPD. And the DSM-5 states BPD is about 5 times more common among first-degree biological relatives to those with the disorder than in the general population. Therefore, we might get a set of genetics and physiological factors that we inherit that may make us more susceptible to impulsivity, anxiety, depression, difficulty controlling our mood, or we might be more susceptible to being highly sensitive and highly reactive to our emotions than individuals without BPD. Also, our environmental and psychological factors play a role in the development of BPD. If you have experienced a trauma during childhood, you might be more likely to develop BPD. Living in an invalidating environment, or an environment that does not know how to respond to your needs effectively in a healthy manner, also shows a strong correlation to those who go on to develop BPD. Maybe you grew up in a chaotic environment, had a parent or parents or caregivers with substance use problems, neglect or abuse, or there wasn't a steady caregiver available. Think about how your caregivers respond to things and situations, right? How they respond to stress, how they respond to relationships and day-to-day living. And now think about how you might be displaying or repeating those same behaviors. So while no single factor directly results in BPD, a combination of these factors are more likely to result in one developing BPD. As always, if you have any questions or comments or anything you'd like us to see answered, please feel free to drop us a line. Be sure to click like and subscribe and continue to follow for our future videos